Good morning. Thank you for joining us. I'm Teresa Mingo, and I have been a member of the Southlake team for 20 years, have 15 years progressive management experience, and over 20 years experience in distribution, inventory management, materials management, systems, and supply chain management. And I was the project lead for the implementation of the automated inventory management system that we are presenting to you today.
Good morning. My name is Heather Stewart, and I am the manager of the Cardiac Catheterization Labs and the Cardiac Short Stay Unit at Southlake Regional Health Center. The two labs that I manage are the Diagnostic Caths and the PCI lab. A bit about Southlake. Southlake Regional Health Center, formerly known as York County Hospital, is located in the community of Newmarket, 40 minutes north of Toronto. We provide service to approximately 1 million residents located in York Region and South Muskoka.
Southlake's current state may look very similar to that in your own organization. Barcode scanning was utilized throughout the hospital, but it was only used for managing our stock inventory items. Supplies were organized in bins or on shelves. Inventory replenishment staff were responsible for stocking stock or inventory items only, and managers, clinical staff, or inventory staff, specifically for the OR cath lab, were responsible for the non-stock replenishment. And sterile processing department was responsible for replenishment of reprocessed trays or instruments. Going from left to right, the pictures shown were taken prior to implementation. And these were pictures of our CVOR, our OR, our emergency department, and our cath lab. The demand assessment and supply staff productivity, looking to improve productivity and efficiencies associated with counting. We wanted to take a look at clinical productivity versus stockouts and overview, and improve opportunities to assist frontline staff when locating product. For case costing fulfillment versus preference card management, staff were applying stickers to sticker sheets, and the challenges that were associated with the manual process for case costing. Managers had to manually observe procedures and understand what supplies were being used during the case in order to develop an estimated case costing for a variety of procedures. Business intelligence and data accuracy, running optimization reports for departments was a long and tedious process. Usage data was available, however, reporting structure was a manual process, and it did not include non-stock supplies or SPD usage. Storage capacity and costs associated with carrying excess inventory. Due to our space constraints at Southlake, many of our supply rooms are less than 70 square feet. There was a need to improve capacity and space utilization for current supply rooms. Our hospital actually had recently completed renovations, therefore working within the current structure of our supply rooms was required. An analysis was then completed to identify why we should consider RFID automation. Through a business case, it was determined that the system itself, the processes, and the equipment would address many of our concerns and challenges. Our goal was to look for leading practices and proven technology, so we're looking for opportunities to reduce costs associated with inventory carrying costs, productivity gains, non-value added tasks, and technology limits. The system considered as part of the implementation consisted of two processes. The two-bin ID process, I'll describe to you first. The system is developed by considering your quotas that you require on hand in your unit, and then that quota is divided into two. Both locations do have an RFID tag associated with both the primary location and the secondary location. And at the time of consumption, so as users deplete the primary supply in the front bin, which could be any of the users of clinical staff, multidisciplinary team, or environmental staff, would remove that label and place it onto the RFID board. The RFID board has an antenna which then sends information real time to our host application through our servers, and has the ability to send the information to our materials management systems at specified times of the day based on clinical activity, sending that information to create orders to our vendors or to our inventory location, or it has the ability to send information via an email to our sterile processing department identifying what supplies need to be replenished on the floors. At the time of replenishment, distribution stores people would gather the non-stock product, the stock product, and the trays and instruments that are required to be delivered to the floor. They would take them up to the department, and at that point of replenishment, they would actually take anything that was left over in the secondary bin, move it to the primary location, and put the new product into the back location, ensuring rotation of stock, which reduces our chances of having expired product on floors. The distribution staff would then remove the label from the board and put it back on the bin, which then would start the process over again. The available cabinets that were offered were not just cabinets, it was complete inventory management system. All solutions offered were high density, maximizing the use of space. We actually had staff identify the low use items that we could put into the top of the cabinets, so they weren't having to call for the product when they needed it. It was actually at their fingertips. It was just in a higher location in the cabinets. All of the bins actually tilt down, so there was no issues with staff not being able to find the product or have to remove the basket in order to pull the product. They could see it by it tilting down. Just to summarize, the benefits of the two-bin ID system: counting and data entry is virtually eliminated. Stock rotation is assured through improved workflow, continuous par level optimization, real-time information flow, and enhanced physical environment. The CCID process was applied to all of our high dollar and consignment products. So at the point of use and the consumption, the system would track the time of the usage and the actual OR suite that the product's being used in through end users putting the packaging into the intelligent receptacle. At that point, the information would then be sent to our materials or to our systems to let us know that that product had just been consumed in a department, which then would identify the serial number or the model number, all the product information, the expiry date, and send that information to our vendors in order to complete the replenishment process. When the product then comes into the departments, and we currently have our cataract center, the receivers would then scan the product into the system, which then would create an output of an RFID tag. The tag consisted of all the data information, the expiry date, the lot serial number, and the product location, so that when the product was taken to the floor, the staff member could then easily locate where the product was to be placed in the cabinets on the floors. And to summarize the benefits, we found there were a cost-effective way to track items on a unitary basis using RFID technology. Includes products-specific labels with pertinent information printed on them. The labels generated include storage location identification for faster put-away, which I mentioned. Enables conditioning in the receiving or other departments. I had mentioned that our cataract center, the conditioning process that I mentioned with assigning the RFID label to a product was done in the receiving department. For our cath lab, we actually had made the decision that our inventory clerks were going to sign that RFID label and place it onto the packaging, and then they would organize it for our distribution staff to put away. It improves all of our replenishment activities and improves all logistics activities.
The high-priced supplies, the non-stock supplies for the procedural suites, the drug-eluting stents, the pacemakers, the ICDs, the ablation catheters, their primary and only location are within the procedural suites. We do not carry excess of them outside of the procedural suites. They are the primary and only location. We did see a reduction in the expired product, that we were able to pre-identify them. We were able to incorporate them into our flow and bring them to the attention of the care providers to use them in a timely manner. And after, now that it's been 3 years, we've been able to realize 2 of the secondary stock locations were now turned into offices. So initially, one was found just after the build, and after a year after we had realigned again and looked at our optimization reports, we were able to again find another office space, which I'm sure we can all say is a high-priced commodity that there's not many of. The return on investment for the cath labs, the 4 procedural suites in recovery, was found within 6 months. This was actually, and there was a complete analysis, and this was demonstrated, the return on investment, and it demonstrated the following points. So as I had said, there was immediate gains in our human resource processes. So the clinical, the nursing staff were no longer involved in eyeballing, picking, replenishing. Our electrophysiology technicians were no longer again doing the same things and manually placing orders. Our inventory clerks, again, were not picking, were not stocking. They were actually able to do their function to be inventory clerks. We had removed the manual ordering process. It had now all become automated. There was an easy way to manage expired or recalled products. The materials management staff was now able, after the business day had completed, to have an accurate list of the supplies that needed to be, whether it be non-stock or stock items, needed to be replenished, and came when the cath labs, procedure room, recovery were closed. There was definitely a very obvious optimization of the supplies within the labs, that we were able to reduce the amount of stock that we had and the carrying costs associated with that.
The only system out there that offered a combination of improved technology through RFID, through the tube-in system, through the cabinets that were being offered. It was a complete solution, which drove our decision to move towards the automated system that we chose.
And then within the analysis that was completed, there was some comments, and I'll just read a few of them to you from the staff. So one of the comments was, the system has greatly helped us to organize stock, always more products to be stocked in the room, which is really important to us, that they like the system. We used to have to leave the room to get items that were missing. Now everything is in the room, and it has really helped us. So it was definitely some of the financial gains that were received and that were recognized, but it's not the hard, fast, measurable items that a business case is developed on, but it's the staff perception as well that's so important, and that they are very satisfied with the equipment, with the technology, with where we have moved to.